Hey there, listeners. Welcome back to Let's Get Oral. Earlier this month, Camille and I were fortunate to be able to attend the 2024 Totality of Care Symposium, hosted by the Integrative Dental Medicine Scholar Society, or IDM, in collaboration with the Lincoln Memorial University School of Dental Medicine. The IDM Scholar Society is a collaborative of health professionals committed to implementation of clinical and business strategies that empower patient and practice health. Over the coming weeks, we are going to share a series of shorter interviews that Camille and I gathered while attending the IDM conference. In this first episode, we sit down with the CEO and founder of IDM, Dr. Witt Wilkerson. Before we jump into it, I'd like to thank the entire IDM team, including Witt Wilkerson, Gina Pritchard, Laura Hooper, and all the speakers and attendees. I would also like to thank the dean, faculty, staff, and all the students who were in attendance at the symposium. It was a pleasure to connect with all y'all, and I look forward to seeing y'all in the coming years at future events. So, without further ado, here's our first IDM series with Dr. Witt Wilkerson.
Let's get oral. Let's get oral.
Hey, it's Let's Get Oral, still with IDM at LMU for the Totality of Care Conference, and I'm here with IDM's founder and CEO, Witt Wilkerson, who's a dentist by trade. I would love to know how you came about this IDM Society and how you came to be here at LMU.
Oh, thank you. Well, it's an interesting journey. I went into dental practice in 1982 and practiced for many years with Dr. Peter Dawson, arguably the most well-known dentist in the world in the 20th century. And his philosophy of care was always, is there a better way? And if there is, then we need to learn it. We need to implement it in our practice right away. And so we always worked under that, umbrella of thought. And we went through many different generations of progressions in dentistry, in perio and restorative dentistry, then into implant dentistry and digital dentistry eventually. And about 2010 or 11, he and I were having a conversation, and I said, "So what's the next frontier?" And he said, "You go find it." And so almost immediately after that, I was attending an implant course in Boston, Massachusetts, and John Tucker, who was teaching the class, and I went to dinner. I was just starting to learn about airway and sleep apnea. And as we were engaged in conversation, he said, "It sounds like you're really, really interested in whole health." I said, "Oh, yes, I am really interested and always have been." He said, "Well, there's a new group called the American Academy for Oral Systemic Health. They call it AOSH, and they're having their second ever meeting this year at the Cleveland Clinic. And they're going to have the Cleveland Clinic researchers, physicians, clinicians speaking to dentists and dental hygienists for 2 days." And so he invited me to go. And I gladly accepted his invitation, and he actually was one of the speakers. So when we got there, we were listening to researchers on all aspects of medicine and the chronic diseases that we are faced with. And what I noticed was in every presentation, the word that was mentioned in every speech or talk was inflammation. And so obviously that was the theme, but not a coordinated theme. It was just the different findings that different folks were finding in their work. And so at the end of that weekend, Dr. Michael Roizen, who is the medical director of the Cleveland Clinic Wellness Institute, he gave the final closing keynote address. And he said, we have a problem in our nation that's going to bankrupt us, both financially and physically. with the increase in chronic disease that we see growing every year. And he said, we only have two choices. One choice is we can put a rationing on healthcare where we raise deductibles, we have pre-existing condition exclusions, et cetera, and that way we can try to control the cost of healthcare. On the other hand, he said the option is that we become rational, and that means that each one of us takes personal responsibility for our health, and we don't depend on our physicians for our health. We go to them for situations for learning, but we take personal responsibility for our health. And he said the problem is the system is so broken that the poor physicians don't have really the time to give to their patients to help educate them and help them understand how to take personal responsibility. He said, but you in dentistry do. And you have built relationships with your patients that are much stronger than we see in the rest of the medical community. Your patients trust you. They do what you tell them to do. They come in every 6 months. They get their teeth cleaned twice a year. They get their x-rays once a year. Whatever you tell them to do, they trust you and follow it. And he said, I want to challenge you in dentistry to get on the front lines of this healthcare crisis that's destroying our nation. And when he said that, it was almost like I felt like he'd put his hand on my head. And, I felt this like, okay, that's
Wow.
it. And then I reflected on the conversation I had recently with Dr. Dawson about what's the next frontier. And I thought, that's it. It's dentistry looking at the whole person, looking beyond the second molars, and thinking about that whole person. And as we had heard about inflammation all weekend, I thought, well, if anybody knows inflammation, it's us in dentistry. We look at it all day long in the mouth, in the gums that are red and swollen and puffy and bleeding. And so now it switched gears for me where I started thinking, from now on, whenever I look in someone's mouth and I see inflammation, I'm going to ask myself, I wonder what's going on in the rest of their body. So no different than if you did an ultrasound of the carotid artery and you saw plaque in there. Well, there's plaque everywhere. It's not just in the carotid artery. And I believe that when you look at gingival tissues and you see inflammation, it's a reflection of what's going on all through the body. And so I determined personally at that time that I would go on a journey to try to find out everything I could about where does dentistry as a specialty of medicine fit into the picture, the team of looking at the whole person, and what could we get involved with that would be appropriate for our specialty. And so I started going to meetings all over the country that were on brain health and dementia and Alzheimer's and cardiovascular disease and diabetes. And I would be the only dentist with hundreds of physicians and researchers. But I would sit in the back and just think, okay, where do we fit in? Is there something we can do? Do we have a role in this? And I began to find that there was. And as I began to meet some of the really outstanding people in research and clinical practice, both in medicine and a variety of specialties throughout healthcare, I began to meet people who were on the same track, who were thinking the same way, who were asking the same questions. And I learned so much from each one of them, but it began to put together a formula for me of what our objective was. But one of the things I found was when I started speaking about this probably 10 years ago, it was overwhelming. Everybody would look at you like, this is fascinating, but do I need to go back to medical school to do these things you're talking about? So I started trying to think about what are the least common denominators that, would be appropriate for dentistry to focus in on that have to do with whole health. And I kept boiling it down, and finally came up with 3 common denominators that if we could just focus on these 3 things, I called them the 3 pillars of this, which I began talking about. There's something in medicine called integrative medicine or functional medicine, which is really about looking at the whole person. And very few do that, but those that do, are really able to help their patients. So what if we looked at our role as oral medicine specialists that way, and we began to talk about integrative dental medicine. And so the three pillars that we developed were inflammation, both local and systemic, airway, breathing, and sleep disorders, and then TMD and malocclusion, which is uniquely, something that dentistry does. But I began to find, as I was seeing lots of patients, there was an overlap of those three in most of these patients. So I had for years seen a lot of patients that had joint problems and TMD problems and bite problems and wear problems and, bruxing problems and headaches and sore muscles. And as I would see, let's say a young fit female come in at 21 and she says, I just feel so tired. My muscles hurt all the time. I'm waking up a lot with headaches. I think I'm clenching and grinding my teeth. When I would begin asking questions about, have you ever had allergies? They would say, oh, my whole life. Is it difficult for you to breathe through your nose? Oh, I really can't breathe through my nose. So you're a mouth breather. Yes, I breathe through my mouth. Do you sleep well? Oh, no, I sleep terrible. Do you know if you snore at night? Oh, I've been told I definitely do. And are you tired during the day? Oh, I'm very tired. Are you having trouble thinking clearly and, maybe in school or at work? Yeah, I have a really tough time with all of that. And so I began to understand that when we would talk about people that would grind their teeth, in the past we would talk about that and think, oh, their bite's off.
Right, just give them a mouth guard.
Yeah, give them a mouth guard. But then I would see people for all those years that I would make mouth guards for, and I made hundreds of them. And then a certain percentage of them, they would just wear tracks into their mouth guard. It was like the mouth guard didn't slow them down at all. And that didn't stop this, what we called parafunction, beside normal function of bruxing, grinding, and clenching. And so I was always troubled by, we haven't gotten to the root of this. We're treating symptoms, but there's something deeper that we're not understanding. And when I began to learn about airway, breathing, and sleep disorders, and the fact that, that turns on the sympathetic nervous system during sleep, where you move from parasympathetic rest and digest to sympathetic fight or flight because you're choking to death, and the central nervous system says, hey, there's not enough oxygen here. It turns on all the buzzers and alarms, and you stimulate from the adrenals the release of cortisol and stress hormones to speed up the heart rate and wake you up out of this sleep that may kill you. Then all of a sudden we started to realize that people are bruxing for a different reason than their bite most of the time. And obviously there's several reasons why you could brux. But I, in just following the research, medical research, began to understand that this wasn't parafunction, just a bad habit. It was actually protective function. It was on purpose for the protection of your life. You've got to have oxygen. So if the teeth happen to get in the way of opening up the airway, which means grinding and moving your jaw forward and back, if the teeth get in the way, then, you've got to have oxygen. And so that was a huge explanation. But you see there where TMD and malocclusions could go right together with airway, breathing, and sleep disorders. But also inflammation is created that way as well. As you're chronically releasing stress hormones. Of course, we know that creates inflammation and insulin resistance and type 2 diabetes and cardiac arrhythmias and weight gain and hormonal imbalances and dysregulation and mouth breathing, a whole bunch of things. And so as we began to just kind of see the pieces of the puzzle come together, it became very exciting. So through my interest in this group called AOSH, which was the first really dental group that started in 2011, I became involved and got on the board and eventually was president. And I think it was 2009 and 2011 of AOSH. One of the things, and they're working on this, but one of the things that was a challenge for everyone was we would go to this 1-2 day meeting a year, and we would hear all these amazing speakers and researchers and clinicians that were talking about everything we're talking about right now and much more. but you would go home and kind of feel like, well, what am I supposed to do? I get it, but I don't know what to do with it. And so we did, some things in AOSH, and AOSH is doing more and more. But we decided that we really needed a group, an entity that was all about implementation. And so Laura Hooper, who I consider the finest research dental hygienist in the world, and Gina Pritchard, who is a nurse practitioner with a doctorate in cardiovascular risk, as we're looking at oral health, but also systemic health and inflammation and vascular risk and things like that. We began talking together really during COVID when everything was shut down. We would get on Zoom calls once a week for about an hour and a half, just talking about where is all this going and what are the possibilities and what could be done. And so we connected with many of our AOSH colleagues and others beyond that, and began talking about putting something together that would be like workshops and symposiums, that sort of thing, that could be online learning, that could be about implementation of these new concepts of integrative dental medicine. So that's why we're here. Now, one of the great goals that we see is getting into the universities, because, I'm in my late 60s, and guys like me are hard to change. But if you find students who think, well, that's what I signed up for in the first place, was to help people be healthier and find solutions, and do oral medicine, not just work on teeth, then I feel like they will embrace that very quickly and have. And so we were looking for universities that would be interested in this, and we met Dean Denise Cook here at Lincoln Memorial University, a new dental school just opened 2 years ago, and she was very interested in developing this kind of oral systemic connection and working with the dentists and physicians and other health practitioners together. And so as we came up and visited last year and had a discussion about doing a symposium, she invited us to come, and she would host this here, and it's been so wonderful. We had a student day yesterday, and we had over 150 dental students and dental hygiene students here learning, the introduction to this subject of integrative dental medicine, and they were so engaged and so interested, and just so bright and great learners that we had a fantastic day. And so this weekend, of course, we're doing that with dentists and dental hygienists. We have, I think, one physician here and nurse practitioner, but we're just continuing that. So we have a group here at LMU as well as online that are learning more about these principles. And we've been fortunate to have some really fantastic researchers and clinicians come in and help us with this symposium.
That's fantastic. I know AOSH, since you brought them up, is doing a conference in Reno this year.
Right.
Are you doing an IDM kind of breakout session?
Well, Gina and Laura and I are all participating there, along with many other colleagues that some are here. And we will have a great meeting in Reno. I think it's the second weekend of September. And we're partnering with a group called the American Academy for Physiologic Medicine and Dentistry, who primarily their focus is on airway. And so we will have multiple course tracks going simultaneously on all aspects of the oral systemic connection, and with an emphasis on airway as well. And so a lot of our IDM scholars will be there, as well, because AOSH is really sort of our home base. We are very much involved in AOSH and love that academy very deeply, and see that as where our roots are. We'll always support them very strongly, and it's a terrific group of people. So yes, we'll be there in Reno.
Excellent. I love what you're doing. I love that you're bringing it to universities. Do you see an expansion of interest there, or?
Yes, as a matter of fact, we've been in touch with a few other deans of different schools that are very interested, and so they're kind of watching what we're doing here this weekend to pursue perhaps a couple different universities next year.
Excellent. Fantastic. Are you also offering any CME courses?
We are. We have online courses that can be found on our IDM Scholar Society website, but we also are getting ready to do a 12-week sort of mini residency.
Oh, I love this.
And people love these. Well, the thing is, people like to learn from home, but they want to know those that are teaching now. So you can do online things that you sit and look at, but you can't interact. So we're going to do a 12-week intensive mini residency, trying to cover what we see as the low-hanging fruit for implementation of this subject, which is primarily about oral pathogens, inflammation, nutrition, airway breathing, and sleep disorders. And so we'll go through 12 weeks. We'll have 12 one-hour sessions with us on Zoom, and then we will cover different topics and give everybody a little homework each week to do and then come back. And in those 1 hour sessions, we'll teach for 30 minutes and we'll discuss for 30 minutes. And so we're trying to just make it simple and something that we can expedite. And so we're going to call it our 12-step program. So we'll have 12 steps over 12 weeks and 12 hours of live interaction. And so that's something that'll be posted on our website and that we're introducing this weekend.
Oh, that's incredible. Fantastic. Well, I don't want to hold you back because I know you have lots to do. So I'm going to close this and we'll revisit with the rest of your team in the coming weeks. And it's been incredible to be here and be part of this conference.
We appreciate you all being here so much and what you're doing to influence so many. It's wonderful. We certainly want to promote you every way we can.
Thank you so much.
Yeah,
Likewise.
of course.
Likewise. It's mutual.
Okay.
Let's get oral.